Welcome to your student radio station, bringing you great shows.
Welcome, this is a Vibes at 5. You are tuned into On Broadway.
Welcome to Would I Lie to You? This is going to be great.
Oh my god, this is...
Great music.
Vocals are so good.
You'll be in love like all of us.
Great interviews.
Hi, we're Blossoms and you're listening to Raw.
So we are here with Greg James.
My name is Eddie Izzard.
Keep up to date with the arts.
We're going to be discussing a few trailers.
Seeing a film like Moonlight, which I felt was much more, I think, maybe progressive.
News and politics.
Presenting you with live coverage of the US election.
People make that decision. That's the entire point of a democracy.
Sports.
Raw Sport Fan City 2-0 to Wimbledon. Jake Feeling.
On-campus coverage.
That's where the band's final.
One of the most professionally polished sets.
Welcome to the big decision. Varsity, the spirit and the drive and the determination. Warwick University have won.
Online and on 12:51 a.m. This is Raw.
Hello. You're listening to Raw 12:51 a.m. This is Bizzle Brash. Boom, boom.
Good afternoon, ladies and gentlemen. Welcome to Insight. This is Raw 12:51 a.m. The time is 10 minutes past 1 on this Thursday afternoon. We've got a very special programme planned for you today. I'm joined by three people coming to us from Warwick Mind Aware, one of the many societies on campus who will be here to tell us all about their Mental Health Awareness Week, and we'll also be answering some of your questions which you've submitted over the last 3 days. I'm going to let the members of Mind Aware introduce themselves because they're all very capable people, I'm sure, so I'm just going to throw it over to you. Megan, you're obviously the president of Mind Aware. Would you like to sort of introduce yourself for us?
Yeah. So, like you said, my name's Megan. I'm a third-year psychology student at Warwick, and I'm the president of Mind Aware.
I'm Molly. I'm a member of Mind Aware, and I'm also one of the mental health awareness campaigns reps on the welfare exec in the SU.
Okay.
I'm Victoria. I'm also a third-year psychology student, and I'm a campaigns officer at Mind Aware.
Great, thank you very much. Right, obviously, to begin with, before we get into the more specific side of Mental Health Awareness Week and what we're doing this week specifically, Megan, could you tell us what sort of Mind Aware is and why it exists and what it does?
Yeah, so we're a society on campus. We've got just over 100 members, and we have 7 of those are on our exec team. We aim to raise awareness for mental health issues, so that everybody can talk about mental health, and we want to help sort of stamp out the stigma that surrounds it.
Okay. And more specifically then, Mental Health Week, is that something which you do every term? What sort of is it for?
So Mental Health Awareness Week always happens in term 2. It's always around week 7, so we've got it this week. And we basically try and put on lots of events throughout the week, either to campaign for specific mental health conditions or just to raise awareness.
Okay, so what kind of events have you been getting up to so far this week?
So this week so far, so we've been around on campus with elephant balloons a couple of days this week, which some of you might have seen, to get people to talk about the elephant in the room that is mental health. We've got a dog de-stress happening this afternoon. What else have we had this week?
We had TED Talks on Monday where we were watching videos. And tomorrow we have aerobics, don't we?
Yeah, we have an aerobics Healthy Body, Healthy Mind event. Wednesday we had a panel event, so we had about 5 or 6 students who identified as having mental health problems themselves, and we had like a Q&A session where they could ask questions, so that was really good.
Obviously, we're on Thursday at the moment. Most of it's happened, but if people want to get involved today or Friday, what should they do?
Definitely. So if you want to get involved, go to our Facebook page. So it's Warwick Mind Aware. We also have a Facebook group which is called Mind Aware Campaigners and Volunteers. We have loads of Facebook events on there. They are also connected to the Warwick SU Facebook page. Have a look at those, or drop any of us a message. You can still get involved. We'll still be on campus for the rest of the week.
Yo, it's your boy Big Nasty, BDL Bass Defense League. You're listening to Raw Bass.
Welcome back to Insight. We're now going to talk about mental health in more detail and a bit more generally as well. So mental health is a term that's thrown around a lot these days, but it seems sometimes that not everyone actually knows exactly what it means. So I'm going to sort of open this question out to all of you. What is meant by the term mental health? Now, it's probably a bit of an awkward question to answer, and a lot of people have different responses, but what would you say to it?
Yeah, it's something we get asked quite a lot, and I would just say that mental health, mental well-being covers everything that isn't your physical well-being. So it's to do with your self-esteem, how you feel about yourself, setting yourself realistic goals, being happy for most of the time, not feeling anxious or depressed. Don't know about you guys, but
I'd say it's being in congruence with yourself, really, being in balance and, feeling at one with yourself.
I think we tend to think that like mental health only covers ill health and ill mental health, and when you have problems, but you have your mental health all the time, whether you're happy, you're sad, or you're angry. Like it's all of like just how you're feeling. Is how I think of it.
Now that we've sort of established what mental health is, obviously mental health is something that's specific to each individual person. Each person has their own sort of mental health condition, their own way of maintaining good mental health. Something that's often quite interesting to talk about is how individuals do what they do to sort of maintain their own mental health and make sure that they stay sort of reasonably content and not unhappy. I can remember a couple of years ago, the sabbatical officers here at Warwick launched a campaign on Facebook where they each uploaded images of themselves holding little whiteboards upon which they'd written things that they did just in their own spare time, privately or whatever, to maintain good mental health. What would your own personal sort of things be for that?
There's lots of things you can do. The term self-care gets thrown around quite a lot as well, and that really is it. People often think that self-care is selfish, and that you should only look after yourself when you are poorly or feeling mentally poorly. But it's not. It's taking time out of your day every day to do something just for you. So whether that's, for me, like going for a walk, getting some fresh air, making sure that you eat something sensible or that you eat at all. Making sure that you speak to people, like don't spend all day in your room on your own.
Yeah, I definitely agree with Megan, 100%. But also, like, an advice I'd give is setting yourself like little targets every day, rather than having this big target. I'm gonna finish my essay today. Just I'm going to read 1 page, or I'm going to read 10 pages, and then when you do accomplish that goal, you already feel like you've done something today, even though it might be a small goal.
I think it's important to try and get to know your mind and your body, because obviously they're linked, and I think that just knowing what you need, like if you need rest and you just need a day in bed, like you shouldn't feel guilty for that. But whereas if you need to reach out, just starting that conversation, that could be easy as just like saying like, okay, I'm not okay, like I'm struggling with this essay a bit, I'm struggling with my mental health. It doesn't have to be like pouring your heart out straight away.
Something interesting that's just arisen from that is you've, I think, Molly, you just mentioned writing essays. Victoria, you mentioned reading, and also writing essays. Do you think the university environment is sort of something which can often lead people to neglect their mental health?
Definitely, yeah. I mean, a lot of mental health problems start sort of in early adolescence and through your sort of young adult life anyway. But uni is a massive high-pressure environment. Not only is there the pressure of the deadlines and the work, but going out and being social and those kinds of pressures, and the fact that you're also expected to be having a really great time all the time often gets to a lot of people, and I don't think people realise before coming to uni that it's not all fun. Like sometimes it is a bit miserable.
Yeah. Okay. I know we've briefly covered sort of tips, but Megan, in light of the university side of things, and the specific risks university presents to mental health, what tips would you give? Especially to freshers, people who've got deadlines coming up, exams, etc. That's sort of more targeted towards the university sphere rather than just in general.
Yeah, definitely. I would say don't wait until it gets really bad. Often people think, they're struggling, they're a bit stressed, and they wait before they have a meltdown kind of thing before they do anything. I would say talk to your personal tutor, and if your personal tutor is no good, go to your senior tutor. Ask for a deadline extension if you need one. You shouldn't need to be like prioritising which work you can fit in. You should be able to do it all. So, yeah.
Is that a sort of seen by the university to be a valid reason then for extensions? Does that normally work, or are they a bit sort of cagey about it?
I think it depends on the department. I mean, I know of people from a few departments, and I mean, psychology myself, they have been brilliant. They often need some kind of proof, so if you are struggling mentally, you can go to your GP and get a note, or if you've got a prescription for antidepressants or anti-anxiety drugs, stuff like that. But they are pretty understanding about it all. Okay.
Do you think more needs to be done at work specifically to accommodate people with mental health problems as well? Or, because it seems like mental health is probably the biggest sphere of health in general, which is neglected, and people are often talking about, there's not enough resources for people struggling with their mental health, there aren't enough avenues for help. Does more need to be done here at Warwick specifically?
Yeah, I couldn't agree more. There's not enough help for mental health anywhere in the country. People, looking for therapy or help on the NHS are waiting 3 or 4 months for their first appointment. If you want to see the counsellors here at uni, again, you are waiting quite a long time, and then you are limited. You get, 3 appointments, and that's it. I know some of the wellbeing team as well. You can see them twice a term, and that's it. So it is really, really limited, and I think we just need way more staff available.
Okay, so it is limited, but what, just for people who don't know, if anyone's listening, who might be worried about these things, might want to seek help, what things exist at Warwick for people? Obviously, we've established that it's a bit,
So Megan's already mentioned the counselling service,
yeah.
Which is based in Westwood, and they offer various different services. You can go for one-off appointments. They have what's called like CBT, which I'm personally taking part in at the moment, which is a more structured program to kind of work out how your thoughts lead to different behaviours. Then there's the wellbeing team on campus, which are based at University House and also in the Rampfell building. They offer drop-ins and also mental health advisors. I'm not sure if that's the right word for it, but you can go and see them and get more advice on just more generally rather than counselling. And then the SU Advice Centre here offers advice on anything you can think of, and they're really open and welcoming. And I don't know if there's anything else that I've missed.
Nightline, I guess, is the other one. Yeah, so that is a really good service that the uni has, where you can call them and talk to them about anything.
Okay. Thank you very much. If you have any questions or issues or anything you'd like to raise about mental health, please don't hesitate to get in touch with us. You can go to the Raw website and use the contact tab. You can tweet us at Raw 1251am or at Raw News Warwick, or you can text in on 075 071 87777. We're going to go to a song now, and then we'll be talking a little bit more about what to do if you have if you think you're experiencing mental health problems, and then we'll be going on to some listener submitted questions.
My name is Sadiq Khan. I'm running to the Mayor of London, and you're listening to Raw.
Welcome back to Insight. The time is 1:30 on this Thursday afternoon. One rather important question to sort of put to my guests before we move on to the listener submitted questions, which is, importantly, what should people do if they think they've got mental health problems, both here on campus, which you have touched on briefly, and in general in Britain? In other words, what help and services exist for these people who are experiencing these problems?
I'd probably say go see a GP. They will be able to help, and I think they're the first people to go see. We advise talk to like your family and stuff, so maybe they could
talk to anyone.
Yeah, talk to anyone basically. Yeah, definitely. But like we mentioned before, there are loads of places you can go and ask for advice, and just to be honest, just to check up on yourself and. Yeah. Okay.
Right. In that case, we will now move on to the listener submitted questions. We've had quite a few, which is good. The first of which is, I'm going to keep them all anonymous. How do I know if I've got mental health problems? Is the first one we've got.
Okay, so I would say as soon as something starts to interfere with your day-to-day life, then that could become a problem. It doesn't mean there's anything wrong with you. It doesn't mean that you're abnormal, and it doesn't mean that you've got to live with it forever. I think a lot of people think of mental illness as, oh my God, I'm being diagnosed as crazy, and then that's it. But yeah, if your anxiety or your like any compulsive behaviour or feeling depressed, if that starts to interfere with your life, so you're not being able to go to uni or go to work or get yourself up and dressed, those kinds of things, I'd say then reach out, try and get some help.
So I think when I first started struggling with my mental health, I started talking to people, and I thought that to struggle with your mental health, you had to literally be at breaking point. You had to be having the worst time ever. But it's okay to just be struggling a bit and still need help. I think there's a tendency to start comparing yourself to what you see on the media or what other people are going through, and think, okay, I'm not as bad as them, so I'm not struggling. I should just get on with things. But it's okay to reach out for help.
Yeah, definitely. I'd also just say it doesn't necessarily, the word struggle doesn't mean that you're weak. No. The same as when you've got a bit of a cold or you've got the flu, you're struggling a little bit physically.
Yeah, I also think because of stress at university, many disorders manifest themselves. And yesterday we had a panel talk where people were discussing their personal mental health problems, and a few people said that actually their mental health disorders appeared throughout their university life. So I think it's quite important to recognise that sometimes when you're feeling stressed and then something you're feeling maybe, like Megan said, abnormal, or there's something different about your how you're feeling, it could be a mental health disorder. It might not be just because of stress. So yeah, go check up on yourself.
Okay. A slightly different kind of question, more specific to Warwick rather than general. The question goes, do you think that the SU should have a mental health officer? And the question also says, I know it was something that was talked about a while ago. Is that something any of you have got opinions on? Do you think that there's need for a mental health officer at Warwick?
So I'm one of the, as I said earlier, I'm one of the mental health awareness reps on the welfare exec. And speaking to the other awareness rep, I think that there is a place for it. It's quite a hard role to fill, but I don't think that with the right training it's impossible, because I think there is the need to really push the uni to increase their funding. I think it's something like between £11 and £12 that they spend per student, which is the same as we would all spend on a meal out.
Yeah.
And there needs to be more someone specialised there to lobby the uni to up their game, basically.
Yeah, 1 in 4 people are struggling from mental health disorder, and there's definitely a demand for that kind of stuff. So I personally think it's a very good idea.
Yeah, I'd certainly agree with both of you. I think so. I think also people don't know where to start, because there are services that the SU offer, there are services the NHS and that the uni offer separately, and I think having someone who could collaborate those together
sure.
and signpost people would be helpful.
Yeah. Okay. Thank you, both of those people who've submitted questions. We'll move on to some more listener submitted questions in a moment.
Do you love news? Follow us on Twitter @RawNewsWarwick.
Okay, welcome back to Insight. We're going to continue with the listener submitted questions in just a moment, but first, Megan is going to tell us a little bit more about her own personal experiences with mental health. Megan, the microphone is yours.
So I am diagnosed with depression, and I've had issues with anxiety and panic attacks in the past. It's something that's not quite as prominent now. But I think it's just really important that people know that loads of people out there are going through it. So I went to my GP after struggling quite a lot for probably about a year and a half without talking to anyone about it. Had a bit of a meltdown, and my mum made me go to the GP. And they suggested some therapy. I got private therapy because the NHS has such a long waiting list. And going between uni and home is always difficult because you're with different NHS trusts. So it isn't ideally designed for students. But yeah, so I've had cognitive behavioural therapy for about 2 years now. And it sounds like a scary thing, but it really isn't. I go and I meet with somebody, and I just talk to them about what's happened in the last week and about the backlog of some of the issues that I've had in the past. And you just work through your thought processes. So a lot of the time when you've got poor mental health, it's just that the way you think about things isn't quite right. And so if you've got low self-esteem and you believe that you sort of feel worthless or hopeless, they can just help you to sort of search for evidence in your life that goes against those beliefs, so that you can start believing things that are a little bit more healthy, I suppose. I'm also on antidepressants, which have helped me no end. I know medication and mental health is a really difficult subject and quite a controversial one. But I couldn't recommend them more. It's not easy, you go through a good month or two of side effects, but I definitely wouldn't rule it out. It's a lot of people aren't keen on taking medication to start with, but it has been really helpful for me.
You mentioned that one of the sort of methods of therapy that you undertook was finding bits of evidence that go contrary to your sort of the intrusive thoughts and so on. Do you find that helps as well?
Yeah, definitely. One thing that I think is really helpful, whether it's therapy or counselling or whatever it is that you have, is having someone in your life that you can go to who's completely impartial, because I know in the past, like, I've confided in my parents or my friends or partners, and there's never somebody who's completely removed from your life, and it's nice to have somebody that doesn't know anything else about me except what I'm telling them, and you know, you can talk about all the people in your life and they don't have any sort of prejudgments of them.
Yeah. Okay. Thank you very much for telling us about that, Megan. That was really interesting and I think valuable to hear. So we're going to go on and continue with a few more listener-submitted questions. I think the next one is actually quite relevant to what you've just mentioned, Megan. It is, the question goes, how can I help a partner who has got mental health problems? Quite a difficult question, I think, but it might have a simple answer. Who knows? What would you three say to that?
We actually had an event that answered that question. We had an event that was how to help a friend with depression, and it doesn't necessarily have to be depression, it could be any other mental health disorder, but we personally, we suggest listen to them and talk to them and just be there for them, really. I mean, it's important to understand that you can't cure someone from their mental health disorder, but you can be there for them. And if, for example, they say that they don't want to talk about it or they don't want any help, you can still help kind of moderately just by doing something together, like going for dinner, I don't know, or like making them a dinner, or just making them feel like you love them and that you're there for them and nothing has changed, even though, you know, they're struggling. They're still the same person, still the same friend, still the same partner.
Yeah, definitely. I mean, it doesn't matter whether it's your partner, your friend, a family member, anybody. The most important thing is just to let them know you're there for them and to tell them that you know that they're struggling, because sometimes admitting it can be quite hard. But it is important to know that you can't force someone to talk about anything, including their mental health, but just to be there and you know, don't be distracted, don't be doing something else at the same time. Be there completely just for them. And often people do open up. Obviously, if they're in a crisis, then you can call somebody for help, but if they are just struggling in that moment, often all people want is just someone to be there. You don't necessarily need to say anything.
Yeah, I think like listening is the most important thing, and trying to like show empathy, and like even if you don't understand it, like asking questions and being like, okay, so is this how you're feeling? Have I got this right? And trying to understand it even if you yourself don't suffer from mental health issues. And I think just like listening to them and listening to what they want at the time, because I think, for example, someone may open up to you one day and then just need a little bit of space afterwards, but just showing that you're always there no matter what they need.
Okay. Yeah, definitely. There's lots of practical things you can do as well, like because I know particularly amongst shyer people and amongst men, often they don't want to talk about their feelings, but there are practical things that you can do, like if somebody's struggling with cooking their own meals and stuff at uni, you could offer to cook a meal for the two of you and share it, and then, you know, they can repay the favour one day, or offer just to go for a walk with them. You know, there are lots of sort of stupid, silly little things that you can do that do really help.
It's interesting that, you know, just doing little small things that seem pretty innocuous can actually be quite effective in helping people. Yeah, that's good. That's important to know, I think. We've had a message in from someone called Mike who says, shout out to Molly, who has done so much for others and me in particular in terms of mental health. She never stops giving, and I know I'd be in a much worse place without her. So, Molly, shout out for you from Mike.
Thank you.
Yes, thank you for your message, Mike. Anyway, next question submitted by listeners. What is the difference between just being sad and having mental health problems? Is there a difference? And if so, how do you sort of detect it? Probably quite a difficult one.
It's a hard one, because if you're having a sad day, then you are having a little bit of a dip in your mental health. But the difference between being sad and being depressed, that there is a difference there. So I would always say that sadness is something that will disappear. So within, you know, that day or that week, that will have disappeared, and you can cheer yourself up and you can still enjoy the things you normally would. But when you're depressed, it lasts a lot longer, and you often can't get pleasure from doing other things. Nothing makes you feel better.
I think that the difference for me normally is that sad can be triggered by something. Whereas sometimes like having a dip in your mental health isn't always triggered by something, you just kind of have it. Like it's not necessarily that it's like something major has happened that has triggered this. Like it can be something very small or just something not at all. Like you can just wake up and like be feeling like you're having an off day.
Okay, we'll move on to the next question then. This is quite a sort of, I don't know, perhaps a little bit more of a medical one. My family has a history of mental illness. Does this mean I'll develop problems as well?
No, is the short answer.
Okay.
So lots of mental health conditions have a genetic component, the same as anything else. And it's also an environmental thing. So if you're in a stressful family environment, then it's more likely that all of you will struggle mentally. But it's certainly not for definite. It's not something that's just passed on. Anyone can suffer from a mental health issue. It's 3 children in every classroom, and it's 1 in every 4 adults. And it doesn't discriminate. It can be people of any ages, any genders. It doesn't matter. It can be anyone.
Okay.
Yeah, I think it's also kind of depends a bit on what kind of mental health disorder, because like schizophrenia, for example, is quite highly heritable. But such things like depression, for example, like Megan said, is really, really affected by your environment, and it does occur, like I said previously, with stress, with some major life event.
Yeah, it depends on the person as well, because 2 people can go, they could have the same genetics and go through the same experiences, but one might develop something and another one might not. It depends on sort of your own personal characteristics.
Your vulnerability to like stress and life.
It's interesting that you mentioned environment, because one of the next questions was actually, is it possible for environment/weather to have an impact on mental health? I think I heard a while ago something about some kind of condition whereby people were more likely to sort of suffer from mental health problems in the winter when it was raining. Is that a sort of an established thing, or is that just a bit of hearsay?
Yeah, that's called seasonal depression.
Okay.
If I'm right, yeah. It's actually recognised that in countries where there's a lot of like winter, like and loads of like cold weather and dark times. That's when people can more likely to develop seasonal affective disorder. And in the summer, it kind of disappears with with the effects of weather.
With the sunlight, it's to do with your vitamin D kind of thing. So getting out and getting in the fresh air and in the sunlight is really important for your mental health. So some people do experience it more in the winter times.
Yeah, but it's actually quite interesting because as a part of our course, we were studying seasonal affective disorder, and it could go otherwise as well. So you can actually develop seasonal affective disorder in the summer. So towards summer, you can develop seasonal affective disorder. So it could be that summer and hot weather could also make you depressed, for example, and not winter season.
I see. Okay, is it ever possible for people to be affected by both, or is it more sort of one or the other?
Oh, I wouldn't know.
I suppose if you're affected
Probably
by
one.
both, that's just depression and not necessarily a seasonal thing.
Okay.
But lots of things affect your mental health. Like they say it's to do with the weather in the winter, but you stay in a lot. You don't go out. You don't do, like, people often go on holiday in the summer. They have nice times. So
time with their family,
it can be lots of other things that affect it as well.
Okay, that's quite an interesting subject. I was wondering if you could just sort of say a little bit more about those sort of everyday innocuous things that can impact mental health, that we might not even know about. You mentioned staying indoors for long periods of time, lack of vitamin D and so on. What other kind of things are there like that?
Eating badly, I put my hands up, I eat rubbish most of the time, but if you do eat healthily, it does really help. Drinking enough water, simple sort of physical health things like that. And socialising is another big one. So when people are struggling, they often withdraw and they'll be in their room by themselves. But I think you should be talking to somebody every day. If you haven't spoken to someone today, go out, find someone.
I think also there's a major drinking culture amongst students, and I think that could be quite harmful to people's mental health. Like, people can either become quite reliant on alcohol to deal with issues, or alcohol can just have a negative effect on them and make their mental health move backwards. So I think that looking at how you're drinking and like your alcohol intake and whether that is having an effect on you.
Yeah, I 100% agree with Molly, because alcohol is actually a depressant, so it does worsen your mental health. And I know loads of people who, with mental health disorders, who after drinking, like the next day or the next week, they are really affected by it.
Yeah.
And they feel worse.
I think it's interesting what you said, Molly, as well about your mental health going backwards. Because often one of the misconceptions that we come across quite a lot is that recovery is linear, which it isn't. You having a mental health disorder, for example, my depression, it's episodic. So I have days, come here, I'm on the radio, I'm doing fine today kind of thing. And then I have other days where I can't get out of bed, and it sort of, it peaks and troughs. And if you are recovering and getting better and then you go backwards a little bit, it doesn't mean that you're going to continue going backwards. But you can certainly sort of keep going in the right direction.
Okay. We've had a couple of messages in actually just in the last couple of minutes for our guests to answer. This is another anonymous question. The person says, what's the best way to deal with stress and anxiety over deadlines, especially if it's affecting your sleep? So probably quite an appropriate one for a lot of students at the moment.
Yeah, sleep is a big one. I know a lot of students end up being basically nocturnal or pulling all-nighters to try and deal with their deadlines. With sleep, I would say the most important thing you can try and do is to get up at the same time every day, regardless of how much sleep you've had. It can be really hard, and I mean, I don't do it all the time, but if you have a housemate or somebody or a family member who can ring you or bang on your door at 10 a.m. every day to make sure you're up, because otherwise your body clock just goes backwards every day sort of from then.
Yeah, I personally think it's important to put your phone aside or whatever, if you're watching something on your computer or iPad, for example. It is important to put it aside and just try and fall asleep. Just maybe turn it off. I know a few people who just turn everything off an hour before they go to sleep and then have a shower and just go to bed. Yeah, because looking at screens does wake you up, blue light and stuff.
Yeah, definitely. I think the other one, not necessarily sleep, but talking about when the question said about stress and stuff with your deadlines, something that I've come across in a few of my friends and in other people is that they have a piece of work to do, whether it's a project or an essay or whatever, and they feel like they need to work on that for every hour of the day until it's due. And in fact, what I try and flip round in people who I've spoken to who are struggling in that way is you've got so much that you need to do, and you divide that up by the days you've got left, and once it's done, and you can submit it and forget about it. As long as you've tried your hardest, it doesn't mean that at 5 a.m. you still need to be doing it. If you've done it and you've checked it and checked it again, then stop.
Okay, thank you very much, and thank you to the person who submitted that question. We appreciate hearing from you. Anyway, unfortunately, I think that's probably all we've got time for today. It's been an extremely interesting and hopefully useful and valuable discussion. Thank you especially to you, Megan, for messaging me and asking to come on. We do appreciate it.
That's all right.
And thank you also to Victoria and Molly for coming on and sharing your insights into how people can help.
Thank you very much.
Yeah, thank you for coming on. Anyway, we'll be putting this up on the Raw News Mixcloud very soon, hopefully today. So check out the Raw News Twitter and Facebook, and also we'll send it to Mind Aware. So look at Mind Aware's social media platforms as well, and you'll find today's programme edited and uploaded for you to listen to again if you found anything interesting or there's been anything in particular that you want to listen to again. Thank you very much for listening.